Francisca. We are part of LxUS, the Portuguese team, and we are here to present to you the translational potential of our biosensor. So did you know that in Portugal there are around 40,000 people suffering from rheumatoid arthritis, and one of them is my grandmother. And yes, that's me, the picture as proof. From all those patients, around 20% are treated with adalimumab. But unfortunately, from those, only 23% of the treatments are actually efficient. And that ends up being having a real huge impact also on the national economical landscape, since the government ends up wasting around 26 million euros a year with those failures. In fact, our national health system only has around 27 public hospitals with rheumatology specialty. So for patients living in the most remote areas, they find it really hard to reach those hospitals just for a regular checkup. So that, coupled with the high flow of patients, leads to long waiting times and therefore a poor monitoring system, since the patients end up only having the checkups twice a year, typically. So remember my grandmother, she lives in a remote area in a small village in the Crosspoint. So for a regular checkup, she could go to the nearest public hospital with rheumatology specialty, which would be here. She would have to travel this far with not very good conditions. So for a better healthcare, she ends up coming all this way to Lisbon. And that, as I mentioned, that public hospital has long waiting times. So she ends up coming all this way to Lisbon for a better care. But as you can imagine, for an old lady, the pain is really huge in a physical load. So our idea is to implement our biosensor in health centers, which are public institutions spread throughout the country, but not only the bigger cities, also in the smaller regions. So my grandmother would only need to travel this far for a regular checkup. So our solution is a point-of-care device for a quicker and user-friendly adalimumab analysis, since we end up improving all these aspects for both the patients and the government.
Regarding our business model, this is our first approach. Our payer is the National Health System, and our users are public health centers. We intend to follow a B2B and hardware plus software as a service model, being that our costs come from the biosensor hardware and development, as well as from the cartridges. We sell a minimum amount of 100 testing packs per institution per year for this price, being that we offer the biosensor hardware. So our business model has several benefits for our customers. If we look for the expenses per patient per checkup test, currently the government pays around 7 euros per test. And with our solution, they would pay 50 euros, which might seem a lot. However, we also have to take into account other external factors, such as all the traveling costs, the wasted time of the patient, as well as their physical load. So it ends up being this huge value on the current situation. With our solution, the government could save 68%. Moreover, if we look for the expenses per year, currently the government is wasting 4.3k euros on inefficient treatments. And since our solution would enable earlier detection of these cases, they would end up saving up to 93%. As to our financial forecast, we estimate having half of the amount of health centers in Portugal as customers by the third selling year, reaching in profits 800k euros by that time. Currently, we have an MVP ready, which you could visit in our stand there. And our next steps are pilot testing, certification, device optimization, and finally, market entry. So this is us, LxUS. Thank you very much, and feel free to shoot the questions. Thank you.
Yes, question over here.
Thank you. You speak of a software as a service solution. Two questions about that. What's going to be the price of the SaaS solution, and where is it? Who's going to pay it? Is it the government or is it the patient itself?
No, yeah. Okay, so everything is, those prices, the cost of both the hardware and the app, is diluted in the price we ask for the cartridges. So we sell a minimum of 10 tests, 100 cartridges, and the rest is diluted in that value. So it's a service we provide.
Okay, but it's based on the cost of the cartridge.
Exactly.
It's included.
So yeah, no, the cartridges are really cheap for us to make.
Mm-hmm.
So we ask for if we would sell separately, it would be 50 euros per cartridge per test. So as we showed in the next slide, but it only costs us €1. So the rest of everything is diluted in that value we ask for.
Okay, and did you consider the possibility on the data which is stored then? How do you cope with that? How did you cope with the GDPR or all those kind of data storage?
Actually, we think that could be valuable for us in terms of partnerships with pharma, for example. We could use that as an asset.
Okay.
I don't know if that answers your question.
I got an idea of where you wanted to go to, so thank you.
All right, another question.
Yeah, that angle with pharma. Have you been talking to pharmaceuticals, and if so, what is the reaction to this proposal?
Okay, we have actually an extra slide in the end. Okay, okay. Because we had several ideas for payers and users, but we were advised to just choose one because of focus. But actually, pharmaceuticals producers could also be a good customer for us, since they can also sell the monitoring system for the pharmaceutical they are selling. So we asked several, we had some advisors in Portugal. So we had an hospital administrator from the public system. We also had the president-elect of Rheumatological Association in Portugal, and they have several connections in those fields. So we had a closer connection with those people, and we had their feedback, and it was quite good actually.
Thank you.
All right. Oh, next question over here.
Well, first of all, I heard you had some stressful days before this.
Yeah, we
so
did.
Actually, now
we are just now breathing.
I was wondering, when I was seeing your grandmother over there, would she be using your app?
No. The app is for the caregiver, for the nurses, for the doctors, the health professionals working in the health centers, and then connected to the rheumatologist. So instead of going, every time she wanted to have a checkup, instead of going to the rheumatologist, so the specialist, she would just go to a regular health center, so a nurse, a general doctor, everyone could do that with a health background, could do the tests, and then it will be uploaded to the app, so the doctor can see if the treatment is actually working or not, and follow the progress. And if there's an urgency or something, she could mark the appointment and get checked.
Anyone else has a question? You have one?
I really like the focus on Portugal and the local problems that you are facing. But since this is completely new to me, I was just wondering if you want to sell this to the NHS and get it used in public health centers. Do you have an idea of what you need to do that?
Yeah, actually that has hospital administrator we were working closely to. He gave us some advices, so people to contact. So we are quite aware of the next steps we would need to do. It's a complicated process since it's a public system and the government has a lot of bureaucracy, but yeah.
Any more questions? From the audience, maybe? No? Okay, thank you very much.
Thank you.
Thank you.